to introduce the title again, we're Eunoia Global Health, and today I'll be talking about global healthcare in the context of science communication and just going over some recent breakthroughs in the field. Okay, let's get started. So first, I'm going to introduce the organization that has so kindly put together this whole webinar and the whole conference. It's Scienceholic, and Scienceholic is a youth-run nonprofit that aims to introduce scientific concepts in a fun, accessible manner for teens, which aligns perfectly with Eunoia Global Health's mission, which is why we're so happy to be involved. Scienceholic offers fun volunteer and leadership opportunities and lots of volunteer opportunities for teenagers, and encourages teens to be critical thinkers, especially in a world that teens are getting more involved in medicine at an earlier age and research. So the more opportunities, the better. And thanks again, Scienceholic, for being so kind to invite us here. And yeah. Okay, so first of all, I'm going to go into some context behind science communication and why it's important, beyond the surface level of, we need to communicate what resources we have to a common audience. So beyond that, there is actually research conducted based on this philosophy in global healthcare called One Health. And One Health basically means that there are three factors that impact an individual's well-being, which are social, environmental, and economic factors. And there are different ways to measure these factors. Obviously, economic is your socioeconomic status, how much money are you bringing in, how many people are in your family. Environmental could be, where do you live? Do you live in a food desert? Do you live near medical resources? Things like that. And to measure these different aspects efficiently, there has been a standardization recently in research to execute this model, which includes intentions, reciprocity, and reflexivity, which we'll go into later. But basically, intentionality is, doing something because you want to, doing something with a specific purpose. Reciprocity means, the other person understands what you're doing and mimics it, and just their body language and language in general just demonstrates that they're understanding what you're putting forward. And basically that's the tenets of science communication. And I already said this earlier, but its significance is really increasing, especially with global media and more people just flocking towards social media and different forms of news. It's a little taxing for caregivers to go through all the information that's available, searching for what's reliable, because depending on your context, you're getting a different source of information. And if you're not a researcher, you don't want to go through a literature review every single time you want to find out which kind of medication is best for you or the person you're taking care of, which is why science and communication, especially if you're not in a European country or a primarily English-speaking country, it's even more important to find these resources. So today we're going to be just talking about significant breakthroughs in global health and how it's been communicated to the public. And based on that, we're kind of going to explore whether these interventions are accessible and how they've evolved over the past few months or years. Especially after the COVID-19 pandemic, our world has become more connected with facing these healthcare issues, because we realized, okay, so there are these huge issues that not one country can control, and we need to be on top of these things and have resources flowing from one side of the world to the next. So staying informed is a big part of that, and global healthcare professionals can expand our reach and potentially save patients who have barriers like economic, environmental, and social behaviors and barriers. Okay, so these are just a few statistics about where we stand right now with global healthcare, and it is really hard to actually find statistics that capture the entire world because, as I mentioned before, a lot of the media, depending on where you live, is restricted to your country, your state even, and where you live. So your Google search engine, sometimes it provides something that's really regional or national. And I went on the World Health Organization's website, and they do have a few developments in state and practice for 2025, but a lot of the statistics haven't been updated since I think 2022. So we're going to go with what they've been projecting for 2025. They have a 2030 global healthcare plan, which we'll be talking about a little bit. But for now, what you need to know is in 2025, since their last 10-year plan, there's been increased life expectancy, growing awareness, and reduced child mortality, which is great. But there are obviously places for us to improve. Some examples include about 585 million people worldwide do not really have healthcare access as of 2025, which is obviously a major issue we should be targeting. But the World Health Organization has a few points that they want to expand upon, which we'll be discussing a little bit. But in the wake of vaccine skepticism and healthcare providers facing widespread burnout and increased demands, it's important to consider our areas for improvement and put that in the context of global healthcare communication. As an organization, Eunoia Global Health recognizes that there's a lot of task paralysis, and when you get overwhelmed with problems, you kind of get blinded to the solutions that are available. So we won't be focusing entirely on problems, even though we could spend a whole different presentation talking about the barriers to global healthcare access. But today we're going to be focusing more on the developments. And if you have any questions about our areas for improvement, I'm happy to answer that after the initial presentation. Yeah. Okay, these are just some more statistics to put it in for visual learners out there. I know sometimes too much text, I can't comprehend all of it in one go. So the example on the left side, I'm holding a blue thing. I don't know if that's working, but okay. So these are just the economic standings of healthcare services on a global scale. As you see, this is 2025. We're spending already quite a bit of money on healthcare, which is to be expected, right? But if you see the arrow pointing upwards, it's going to have an exponential increase over the next 10 years. And this is just in the United States. On the right is the global medical imaging market. And as you can see, Asian countries and mostly Asian countries in the Middle East are experiencing exponential growth in the healthcare provisions they're providing on a global scale, which is amazing. And we'll be going into what exactly these developments are and why they require such a big share of global markets. Okay, so the World Health Organization's 2025 to 2028 strategy is focusing primarily on 4 key concepts. And I pulled this from a really long document they had about obviously more detail into these 4 concepts, but this is just a brief overview of what ways they plan on tackling. Oh, is everyone okay? Okay, I can't. Yes. So if you have any questions, you can just unmute. Okay, so the first tenet of the World Health Organization strategy is responding to climate change. And I'm sure you all know what climate change is because it's just everywhere in the media. Unfortunately, even though it's in the media a lot and there's a lot of advocacy surrounding it, it is now classified as an existential threat, which means that we need to take more action, as I'm sure you all know. So that's pretty straightforward, even though sometimes straightforward problems don't have straightforward solutions. Secondly, we have addressing social determinants of health, which means weeding out root causes of health inequity, which, as I mentioned earlier, could be your environment, the people you're around, the stigma associated with it, your political situation in your country, that kind of thing. The third strategy plan is evaluating financial disparities by providing global goods for health. That includes kind of psychotherapy training for people who want to provide telehealth services or working with insurance companies, things like that. And lastly, advancing gender equality and kind of level the playing field for all countries joined in the WHO's agreement. So basically emphasizing collaboration among different countries. Again, easier said than done. We know the political atmosphere of a country determines how fast these public policy can take effect, because global healthcare is really intertwined with public policy and politics, which is just how these things work. Okay, so now I'm going to be getting into more of the developments that have happened over the recent years in global healthcare. So the first thing is more of a broad approach, which has really gained traction over the past few years, which is called personalized healthcare. So personalized medicine is a treatment plan where these pharmaceutical companies focus on the individual rather than a group, because healthcare is very tricky, especially with rare diseases. You can't really find a one-size-fits-all solution for these rare diseases, or treatment in a different country that doesn't have the same vaccine access as a different country. So according to Business Wire, the global personalized medicine market is projected to reach $869.9 billion by 2030, which, big numbers. I can't really put that into perspective, but it's a lot of money. So North America has the greatest market share for now, but as I mentioned before, South American and Asian countries are really catching up to that, which is great because we are trying to advance these treatments for everyone. And some examples about what these countries are doing to center their treatment plans around personalized healthcare. The first one is Japan is investing in genetic treatments for cancer and telehealth services, and Latin America is introducing health diagnostics using artificial intelligence and other technological apps to combat the rise in prevalence of chronic diseases. So this is great because personalized medicine is really centered around a case-by-case basis. And in a world that's becoming more, let's try to lump everyone into one group and fix the whole situation, adopting this approach is very beneficial. So some more breakthroughs in medical tech. The first one is regenerative medicine, and some of you may know this as gene editing or developing replacement organs. Investing in gene editing has become very common over the past few years because a lot of research has shown that certain neurodegenerative diseases may have better odds of recovery if you replace the organ entirely. Obviously, brain replacement like we're not there yet, but heart transplants, lung transplants, we're really getting closer to solutions for these things. And there's been more funding and research directed towards regenerative medicine in general. And secondly, telemedicine, telehealth, teletherapy, it's everywhere, especially after COVID-19. Meeting with providers through Zoom or through a screen is so much more accessible in countries that may not have just access to a doctor right down the street or like a 5-minute drive away. And expanding the reach of critical care to remote areas is just a really powerful way that technology is improving global healthcare access. Okay, now AI. Everyone has some opinion about AI, and a lot of these opinions are not good. But in healthcare, AI has the potential to really make doctors' lives easier. So over the past 20 years, AI use in healthcare is projected to increase by 44%. And that is a lot. Like that is, for some reason, for me, percentages are easier to comprehend than like just flat out numbers. But medical treatment is expensive, hands down. But these medical advances can make it easier for doctors to identify certain symptoms and match volunteers who are interested in clinical trials or donating blood to specific centers, just kind of streamlining the whole process. And AI is also like doing some mundane tasks like data analysis and detecting even early onset cancer, which is just amazing because there's really such a vast frontier that we don't really see the end of, especially with AI. I mean, using it with caution is important because it tends to hallucinate, especially with marginalized communities, and it has the potential to not be the most reliable or efficient. But as AI improves at the rapid pace it is improving, we can see a huge improvement in how much doctors can incorporate it on a global scale. Okay, so which brings me to ethical considerations. Obviously, consent is a non-negotiable, which makes solutions a little bit harder to wrap your head around, especially with gene editing technology and AI, because obviously in these areas where healthcare access may not be so prevalent, also the finances of the people who need care may not be as high as someone who may be middle class or upper middle class or really rich. So breaking this down in more simpler terms, you may have the potential to cure a life-threatening disease and prevent it in a newborn, or just edit the gene and the baby will be fine. But in a world where you could potentially genetically enhance your children using the same technology, if you have enough money, it brings into some ethical considerations. Like, should we be doing this? Is this the right way to go about medical treatment? And what's the borderline between science and ethics, and what's considered fair. And that debate is continuous. It's the same with, animal testing and other considerations in medicine, like vaccinations. I know that a lot of people, especially in America right now, are really especially after COVID-19, a lot of vaccine skepticism is still out there, and everyone has their own personal beliefs about it. But it's important to consider that people's willingness to take these treatments sometimes can be based on claims that may be false or true. It just depends on the situation. And again, tying it back to global communication, that's why it's important to always know where you're getting your sources from, which is why global healthcare is so important in the context of science communication. And here we are, enhancing science communication to make sure these things don't happen. So I'm not going to read all of this because it's quite a bit to get through. But to break it down, there are three main points: identifying your goals, talking about the process, and avoiding complex jargon. So I'm going to start with the last point first, actually. So complicated jargon is all the fancy words that scientists use that, wow, they sound so smart, but I really don't know what they're saying, which defeats the whole purpose of learning anything from them. Because, these people need solutions, they need care, they need treatment, and they need someone who's willing to listen to them with empathy. And you may come to them with the best of intentions, but if they don't understand what you're saying, you already create a barrier of trust because you want them to trust you. And you can't gain trust by using words they just don't understand. And obviously you can adjust this based on the context you're in. And if you ever, as future healthcare professionals, if you're interested in learning a different language, that's even more helpful because you can expand your reach to more people. And that leads me to the second point, which is identifying your goals before you go in and speak to them, and talking about the process. A lot of the times mistrust in science comes from an underlying issue, which is that researchers focus more on the results rather than how they arrived at those results. You might think, okay, I want to know what the medicine does, but sometimes you want to know how it works because you're getting something put into your body and you don't really know what's in it. And some researchers think, okay, I did the research, I did so much work, of course I know it's reliable, but the person on the other side doesn't know all the work that's gone into it, so they may not know exactly how to present that information to someone else, which is why people who are interested in global health and public policy and science communication and journalism, their job is to present the material in ways that are accessible, which is why as future healthcare professionals, I recommend even improving your writing skills for this purpose, because as it's a really marketable soft skill to have. If you have good writing skills, you're able to kind of break that barrier that gets set up between you and the public, because you all are going to be doing some incredible research one day, and you want the people who are getting the benefits out of it to understand how much work you've put into it and all the ways it can help them. And to conclude, and I'll definitely have lots of time for questions after this or anything you want to ask me about global healthcare, communication, journalism, anything like that. But the two main takeaways are health literacy is really, really important. And I cannot stress this enough because our world is becoming more connected as the years go on. We're on social media, we're on the news all the time. We know more about other countries than we ever have before. There's international trade, and with that comes a lot of responsibility because there are so many different studies happening and breakthroughs happening all over the world, and it can become a lot, especially for caregivers in remote areas or people who don't speak the primary language of where they live. It's important to approach these situations with empathy. And also when we're studying, we're not doctors yet. We're not healthcare professionals yet. We're not even researchers yet. But the thing is, when you go into a field that's that has so many layers, you want to make sure that you're approaching it with that in mind. You want to approach global healthcare in general from a perspective that adopts the perspective of the carer first, and then, talking them through what developments have been made rather than just going in with your own ideas and not addressing their concerns first, which is something that personalized medicine really puts at the forefront of healthcare discussions. And lastly, the main thing I wanted you all to take out of it is healthcare awareness is more than just public policy advocacy or putting together a literature review and saying, oh, this is way more readable, I'll just give this to the public. It's about making a conscious effort to learn too. And there's so many things I still don't know about global healthcare issues compared to someone who lives in that area. So talking to people, oral histories, just putting yourself out there, like looking on Google, just figuring out what's the difference between a research study conducted in Brazil compared to the United States or Europe or Japan, and making those connections and drawing those conclusions is really important. It teaches us to grow a little more from the perspective we're kind of stuck in sometimes. And I hope you learned something today, but that's all I have for my presentation. And, okay, I should probably talk about this, but we are going to be, Scientology at least, is putting together an amazing global public health and ethics magazine. It's going to be on our website and their website in, I think, the next month. I'm not really sure, but we're all going to be putting together some amazing pieces about some of the issues we talked about, the developments and all that. So feel free to read it. You might learn something cool. And let me see if there's anything else. Right, okay. So these are Scientology's social media. Again, please support them. Their conference is something, I was really happy to be a part of. Our organization is really grateful to theirs for organizing this whole thing. And I can put these in the chat if you're interested later. And you can also work with them as a team member, a blog article writer, or join their mailing list. Also put that in the chat. I think I can just share the whole presentation with you too. But before I stop sharing my screen, Eunoia Global Health is accepting applications to our course. You can find it on our social media, and anyone can join it as long as you show a demonstrated interest in all the assignments. We provide feedback, and we've had over 200 signups so far, and people seem to like it, which is great. And if you are interested in writing, being a blog writer for us, or just have any questions or want a mentor or anything like that for research, you can talk to us. We have some resources for you. You can set up a chapter. We're really all about access and growth. So, we are really open to any ideas you may have. And again, I'm really sorry about joining a little bit late today, but I'm glad you still stuck with me and were able to learn something, hopefully. And after I stop sharing, I'll ask if you all have some questions, if that works. Okay, so does anyone have any questions?
There's been a question sent to me. So, how can one navigate the pre-existing health literacy barriers in lower socioeconomic regions/countries?
Oh, sorry, could you repeat the question?
Yeah, of course. So how can one navigate the pre-existing health literacy barriers in lower socioeconomic regions/countries?
Right, and obviously this issue is something that no one person can tackle alone, but right now we're making some really conscious efforts, especially in my opinion. I think telehealth is something that could definitely reach those in remote areas with lower socioeconomic statuses, because it doesn't require a healthcare provider to be like immediately on the scene for teletherapy or telemedicine. In terms of medicine and providing more accessible ways to give those in need more medicine and like more accessibility to medicine, I think a lot of that has to do with the country you're living in and how much funding is allocated and just their healthcare system in general. Unfortunately, we live in a world where politics and healthcare are really intertwined, which makes it challenging, depending on the climate of the political atmosphere, to kind of gauge how we can improve access. But as a student, I would recommend at first like learning what's out there, like learning what barriers there are and doing small things like in a community-based level to help improve your community, like food drives or clothing drives, or volunteering at a hospital and seeing, okay, what does it seem like they need, and do people who come here feel like they have what they need? Even just interviewing the staff, interviewing people in your community, and then publishing something about it in a local newspaper. Anything that spreads awareness with action is really beneficial. I don't think anyone seems to have any other questions.
If no one else has any questions, then we can end the session now, if that's okay with you.
Oh yeah, sure. It was great to speak with everyone. I hope you all learned something. But yeah, thank you so much.